We're going right to the phones now. Looks like Chord is calling from Missouri. Hey, Chord, thanks for the phone call. You are live.
Hey, how's it going?
Pretty good. How about you? Happy Friday.
Thanks for answering that question earlier in the week, but I actually have a more important question here. It's actually with a friend that actually called me yesterday. He used to be a workmate. Me and him are pretty good friends, but when we were talking, he said his health ain't doing very good at all, so he kind of filled me in, and me and him used to work at a dog food plant, and he was there for like 6 or 7 years, and he was like an unloader, so he unloaded like the raw materials and stuff.
Yeah.
And this is kind of an interesting case because I don't know if you've covered this type of situation before, but he doesn't have like a disease or nothing, but what's wrong with his lungs is he's been going to the doctor for like a year now. He doesn't work there anymore, but because of this, but he's been exposed to like really bad chemicals, and the type of chemical he's been exposed to is like Aflatoxin and Diacetyl. I don't know if you've ever heard of those.
Yeah, aflatoxin. Yeah, aflatoxin's a big bad voodoo daddy. Yeah, I know all about aflatoxin. Yeah.
Well, I guess he's been exposed to it, probably about many years over, small little amounts, and not wearing a mask or anything like that. But what's really concerning is what he said when he's been going to the doctor and everything. They give him inhalers and all types of drugs because he showed me them when I worked with him, about 6 months ago. But they said that his lungs are like 100% crippled or something like that. But to me, that sounds like if your lungs are 100% crippled, I don't think you'd really be alive or breathing at all. But
exactly correct, man. And this is just common sense, right? I mean, why do we let knuckleheads get away with telling us stuff like that? Oh, you have arthritis of the lungs. What? I actually had a patient call up a month ago. My doctor told me I had arthritis of the lungs. What? You can only have arthritis in the joint. What the heck does that mean? It doesn't mean anything, number one. And number two, you're right. If it's 100% bad, then that means his lungs don't work, and that means he can't breathe, and that means he's dead. One more reason to fire your MD now. All right, Chord, you've got my attention now. What else did they tell him?
Other than that, the reason I wanted to call you is that he has like I guess he's been talking to like world-class doctors and, whatever, up in Kansas City and whatnot, but he's actually scheduled for a lung transplant, so I was just want to call to see if this is one of those cases of point of no return,
Okay, well, number one, he's still alive, so there's hope. If you're above ground and still breathing, then there's hope, okay? Number two, the medical doctors, because of their philosophy of healing, reductionism, and because of their treatment strategies, and because of their clinical experience, they do not know anything other than drugs and surgery. So from their perspective, a lung transplant is his only option, right? It's his only option because they don't know anything other. They have no experience with anything else, and they should be ashamed of themselves because there's lots of literature. I mean, there's lots of research. There's lots of doctors doing this work, and they just pay no attention to it. They're like the ostrich that sticks its head in the sand. And it's bad, man. It's cowardly ridiculousness, and why we put these people up on pedestals is beyond me, honestly. So, there is a point of no return, right? I mean, there is a point of no return beyond which it's impossible to support and promote the structure and function of that part of the body because it's gone by the boards. Now, neither you nor me, the only person that knows where that point of no return is God. You don't know it. I don't know it. The doctor certainly doesn't know it. And you can never unsurgery something, right?
Right.
So my recommendation for your friend would be give our program a try for 6 months. And here's why. Worst case scenario, nothing gets fixed. The lung tissue is beyond the body's, it's gone so far south that the body can't fix it. It's over. A lung transplant would benefit him, and hallelujah, and pass the hat, that's a good thing, right? That's the worst case scenario, right? He needs the lung transplant and the stuff won't work. But even if that's the case, surgery, especially a lung transplant. I mean, can you imagine that? I mean, do you want to be horrified? Do a Google search for lung transplant and look at the pictures. I mean, it is a major invasive surgical procedure, and then you've got to be on these anti-rejection drugs for the rest of your life. I mean, it is not an appendectomy. It's a big deal, man. So if you were planning on going to the Antarctic, right? If you're going to take a trip to Antarctica, you would probably, it is my, I'm going to guess that being the smart man that you are, you wouldn't just go to Antarctica packing summer clothes in a bathing suit, right? If you're going to take a trip to Antarctica and hang out in minus 20 degrees weather for, 3 weeks, you're going to get the best survival suit, the best long underwear, the best wool socks, the best down-filled suit. I mean, you are going to man up and load yourself up with stuff that you can survive in cold weather in, because that's just smart. Well, if you're going to have a major surgery, it would be prudent for at least 3 months before surgery to load your body up with nutrients and support and strengthen your body metabolically so that it is more able to handle the stress of the surgery. So, either way, this program is going to benefit your friend, because in the sad situation where his lungs are just too far gone and he waited too long to get in touch with us, or, he should have worn the mask and he didn't, then the therapy is going to help to strengthen his body so that he can handle the stress of the surgery, and that's never a bad thing. So my recommendation for him is follow our program for 6 months and look to see what happens. And if there's improvement, well, keep doing it. Keep doing it and keep doing it and see how far back the lungs come. They might come all the way back. I have no idea. They might come back 5%, 10%, 20%, 30%. Who knows? Nobody knows. That's my point. So I would advise him, this is not a life-threatening thing. He's above the ground. He's breathing. It's not 100%. They told him that to try to, brainwash him into just going forward with the lung transplant surgery, for goodness sake. So